Hello. Let me take my mask off so that you can hear me. My name is Steve Long. I'm the CEO at Hancock Health and Hancock Regional Hospital, and I'm here to give you the fourth community update. If you are interested in seeing the prior three community updates, please go to our webpage, www.hancockregional.org/coronavirus, and you'll be able to see all the updates that we have been doing. But I want to take a moment and tell us about where we're at as of April 26th in the COVID-19 journey. And I want to talk about the way forward. But first, I want to say a huge thank you to all of the people in our county who have been so supportive during this journey that we have all been on together, and especially supportive of our healthcare organizations. It is amazing to be in a community like this. I want to send out a special shout out to the folks that are our elected leaders and our governmental leaders, because they have been incredibly supportive, and that ranges from the county commissioners and the county council and the Greenfield City, and then also the towns that are around the county. All of them have come together and been so supportive and worked very, very well together. And one of the ways that we have seen this is in the COVID-19 task force. It is headed up by Misty Moore and our emergency management agency, and it is made up of all of these different organizations and governmental entities, and we're around the table every week on Wednesdays, and we talk about where we're at, what we need to do, and where we need to go next. So I'm just thrilled to be part of this organization and the things that are happening. So our task, if you may recall, and if you go back and look at those initial briefings, you'll see this, was fourfold. So this was toward the beginning of our journey, and we knew that social distancing would be key to our success as we move forward. We believed at the time that we had about 2 weeks to turn the tide, because at that moment, we were seeing a very strong exponential growth pattern in the number of cases that were happening in our county and in the state of Indiana. We then believed that we had about 4 to 6 weeks after that. It would go through about the end of April to the middle of May to really make a big difference and to see what would happen toward the end of this current part or current phase of the journey. And we also then said that we would know that we were successful if people thought we were crazy. And in fact, they would think that we had overhyped everything and that it was all for nothing. And I will tell you that there are many people that are thinking that right now. So we believe that may actually be the case and we may be successful. So here's what we know, and that is that this virus is spread from human to human via respiratory droplets. So when you cough or sneeze, the virus is inside of those droplets. So if it comes through the air, we know that it's important to keep a safe distance, to cover your cough when you do cough, and wearing a mask. Now, the thing with the mask is that it is not meant to protect yourself. I mean, it offers some protection. It is primarily meant to protect the people around you, because it can capture that cough and capture those respiratory droplets. Now, we'd also know that it can be transmitted through personal contact, like shaking hands or giving hugs, things like that. And that is why it is so important to wash your hands with soap and water, because that actually has the ability to destroy the virus, or alcohol sanitizer could do that as well, and really not to have any unprotected personal contact. And then it also can be transmitted through surfaces. So you can't see it, but I'm sitting at a table right now. And if there was a person with the virus that had been here before and they had not cleaned up and they had not been washing their hands, it could still be on this table. I could be touching it, and then I would touch my face, I would touch my eyes, and that's how it would be transmitted. So we know that when it goes through your mouth or your eyes or your nose, that it then attaches to the cells that line your throat and your larynx. And these viruses, I mean, you've seen the picture of the virus. It has all these little spikes that stick out, and those are perfect for locking into cell receptors, and it really nefariously slips its RNA into the cell. And then it hijacks that cell, and it causes the cell to replicate versions of the virus. And then those pieces of virus, they burst out of the cell and the infection spreads, and your immune system senses this, and it triggers antibodies. So these immune cells begin releasing antibodies that attack the virus, and that is how it works. And if you have a very strong immune system, those antibodies get in there and it takes care of it. And again, many people don't even know they have it. But for some, they have a depressed immune system. It may be a suppressed immune system because of medications, and they're the ones that are at risk. So here's what we know. Most of the people that have the disease don't even have symptoms, right? They're just out there walking around, shedding the virus, don't even know it. Some people have symptoms, And usually they're pretty mild. They're like a fever, a cough, tiredness, shortness of breath, kind of things that you might get with the flu. But we also know that there's some other kind of odd symptoms. Now, some may seem like the flu: aches and pains, congestion, runny nose, sore throat, maybe even diarrhea, or a loss of sense of smell or taste, or even pink eye has been found. So there's a variety of symptoms. Some people have really severe symptoms, and this typically is when it's attacking their lungs, and they have trouble breathing without oxygen support, or even without the ability to have a mechanical ventilator, a breathing machine. And then we know that there are some people that also die. Here's what we know in Indiana. There have been 82,000 people tested so far. That's about 1% of the state. 15,000 of them were positive. So 18% of those that were tested were positive. And then out of those 15,000 people, 3,000 have been hospitalized. So about 20% of the people that were positive were hospitalized. And then there were about 800 deaths so far as of this morning. That's about 5% of the positive cases. Now you could look at this and say, well, what's the real infection rate? I mean, we've only tested 1% of the population. There could be a lot more people with the disease. And in fact, we believe there are. And if you look at some of the studies that are happening in California and New York, you will see that in some of the big cities, the infection rate is upwards of 10, 15, 20%. And out in the other parts of their states, it may be as low as 4%. The thing is that we know that it's higher than what we're testing. But it's important to remember that there is always a face attached that's attached to every number. So this particular picture is of my daughter. She is in her 20s. She lives in Texas. And she FaceTimed me as she was sitting in the passenger seat of her car as her boyfriend was driving her through the drive-through COVID-19 testing facility. She was tested for it. She was also tested for flu and strep. Those were negative, so it's fairly likely that she has it. And I will tell you that I kind of stole this picture from her, but then I asked permission to use it afterwards, and she said, sure, Dad, but use this one instead. I guess there's a way to put butterflies on your face. And anyway, this is the one she wants you to know and to remember. But my daughter may have this disease. Now, I'm not terribly worried about it, because when you look at our statistics from Indiana, what we find is that the majority of the people that have the disease are actually under the age of 60. But if you look a bit further, you'll find out that although those over the age of 60 only account for 40% of the cases, they account for 90% of the deaths. So my daughter, who is young and healthy, is likely in good shape. But my 86-year-old father-in-law, who lives in our house, is at terrible risk. And so we're protecting him. So there are three ways out that I can tell. One is that we can achieve herd immunity. So this is where there are enough people that have had the disease that they are immune to it. For this disease, we believe that is somewhere between 40 and 70% of the population. So we can get to that point either by infecting enough people, so we just kind of let it run rampant, we get to the magic number, and then there we go. Or we can vaccinate enough people. We develop a vaccine, we vaccinate enough people, we achieve herd immunity. Or we could just say, let's get some treatments that work. And it doesn't matter if you get the disease or not, because we can just treat you. Certainly, there are many treatments that are underway right now. You've heard of them, the antibody plasma infusions, remdesivir. These are trials that are actually happening right here in Indianapolis as well as around the world. Hydroxychloroquine is another one that you've heard of, and there are others that are under evaluation. I will tell you, though, that none of them have been proven to be so effective that we are all doing them. So we're still waiting for a treatment. The other way that we could do this is just to say, let's permanently social distance. We'll just never get together again. Well, that doesn't seem likely. And as I look at the entire list here, there's only one that really seems attractive, although attractive isn't even a good word, and that would be vaccination. So vaccinating people appears to be the real way out of this thing that we're in. So with that in mind, how have the numbers changed since we last talked? Well, as of this morning, there were 2.9 million people worldwide that had this disease. Well, how does that compare to the last couple of weeks? Well, we've done this now about every 2 weeks. We do these updates. So the last time, 2 weeks ago, there was 1.8 million people infected. And 2 weeks before that, there were 685,000 people infected. So you may look at this and say, well, that doesn't seem very good. It seems like it's climbing actually quite a lot. And in fact, it would be true. So you may recall these graphs. On March 16th in America, there were 4,600 people that had this virus. 2 weeks later, 124,000. 2 weeks after that, 533,000. And 2 weeks after that, which is today, 960,000. Now, this doesn't seem great. We went from 4,600 to 1,000,000 in just about 6 weeks. Now, how can that be? Well, here's what I want you to see. The difference between 4,600 and 124,000 is 25 times difference. But the difference between 124,000 and 533 is about 4 times difference. And the difference between 533,000 and 1,000,000 is only about double. So while the numbers are big, they are not growing at nearly the same rate that they were back in the beginning. Now, what about Indiana? So 6 weeks ago, we had 30, and then we had 1,500, and then we had 7,900, and then today we now have 15,000. And in fact, just in central Indiana, Marion County and the contiguous counties, we have almost as many cases today as the entire state had just 2 weeks ago. But again, the growth factors are much lower now than they were in the past. But it is important for us to remember that even though only 1/4 of the number of people that live in the state of Indiana are actually in central Indiana, we have half of all of the COVID-19 cases, and we have 55% of the deaths. So we are mismatched. Now, I can tell you 4 weeks ago, 2/3 of all the cases in the state were in central Indiana. But because of northwest Indiana and the things that are coming out of Chicago, they have been rapidly catching up. But it's important for us to know another thing. If you look at Marion County, down here at the bottom, they have about half of the population of central Indiana, but they have 65% of the cases. And we, on the other hand, in Hancock County, have only 4.3% of the population, and we only have 2.4% of the number of cases. So we are underrepresented. I imagine that when we begin to open things back up and commuting starts between the ring counties and Marion County, we're going to see this kind of spread out and equalize. So just keep in mind, we've had a remarkably good journey so far. Now, you may remember when we last talked that we looked at the number of cases in Indiana. These are the number of new cases that were happening every day. And we mentioned that there were 3 phases. At the beginning, it was very exponential, and then it moved into a strong positive but linear growth pattern. And then it seemed to have leveled off when last we talked. And in fact, we had some hope that not only was it leveling off, but perhaps it was on the verge of going down. Unfortunately, I can tell you that these are the data points since we last talked. And indeed, for a few days, it looked like it was going down. But over the last week or week and a half, it has been going up again. In fact, we've had some of the highest days ever just in the last couple of days. But what I want you to see here is that this appears to be just variation around an average that's appearing, an average of about 500 cases a day. This is important for us to know because if it is predictable, then it's manageable. Now, there are many people that might say, well, don't even look at cases. They don't matter because it's really an artifact of testing. The more we test, the more we find. And I would say that's true. But if you were to look at the number of statewide deaths per day, you see the same kind of a trend. Rapid growth at the beginning, leveling off, peaks and valleys. You really can't look at the last couple of days because they're going to grow over the course of the next week as deaths are attributed back to those days. But really the flattening out appears to be real, and there's just movement up and down around the average. So here's what we see in central Indiana. So we also had the very large increase at the beginning, and it has really flattened out. In fact, this dotted line in the middle, this is the weighted average over 14 days. So it's kind of a 14-day rolling average. And you can see that we really have averaged out here in central Indiana to about 225 new cases a day. Now, this is not a good thing, right? It's never a good thing when you have more people getting a disease. But when it is predictable, it is manageable. So this is why what we have seen here at Hancock Regional Hospital, and that we saw growth as this thing was progressing, and then it peaked, and then it came down, and it went up just a little bit lately. But we are just averaging about 6 patients that are in the hospital all the time that have this disease. These are patients we would never have had before because the disease is new. And we know in Hancock County that there are about 6 new cases a day. So we just plan on the fact that we're going to have 6 to 10 or 12 patients with this disease in the hospital at any given time. This is something that we can manage. So you may recall from our last update that there is this wonderful article that I had found, and this graphic is great in helping us understand what we're doing. So this was looking way back at the beginning, and it had 3 possibilities. One is that we did nothing, and it was just this exponential climb, and you can see that over here, and we would have overwhelmed the healthcare system. The second one is kind of mitigation, where we do a little bit, but not too much. And the third one is what they call the hammer. I would say that we have been inside the hammer for a while now. And in fact, I think that this is where we're at. We're on the downhill slide coming out of the hammer. But it doesn't really go away. We go into the dance. And the dance is really all about buying time to create a vaccine. That's what we're trying to do. So the hammer and the dance is coming. And the key to the dance is keeping this R naught, or the infection rate, below 1. And if you don't remember what that means, the infection rate, if it's below 1, it means that it's on the decline. So one person gets it, they don't really give it to anybody. If it has an R naught of 1, that means that I get it, I give it to one person. An R naught of 2 is that I get it, I give it to 2 people, they each give it to 2 people, they each give it to 2 people, and then it expands rapidly. Now, the R naught can't change, but social distancing can artificially reduce that number and bring it down to a place where we're not expanding the virus so quickly. So here's what I can tell you. All of these things that we have done, you can read the list. These choices are working. We were on our path straight up, but we have bent that curve. This is a very good thing, and we need to continue being patient. The new normal is coming. I think we are just weeks away from the new normal. And please know, this is not the old normal. It is not going to go back to the way it was. In fact, I don't think we're going to get back to days like that until we have a vaccine. The new normal in the meantime, which is in the next 12 to 18 months, is this. Hospitals, we're going to open back up. We're going to begin offering the same kind of services we did before, but we're going to do it in a different way. We're going to do it without waiting rooms. We're going to have limited visitation, more than we have now, but still limited. We're going to protect our supplies that we need just in case there is a surge of COVID-19 patients. So that means we're not going to do quite as much of the stuff that we did before, and we're going to be very careful about it. Travel is going to start back up again, but it may be different. You go to the airport, it may queue up differently. You may be seated differently. Workplaces are going to reopen, but we may re-engineer things. People may work at home from now on. Restaurants are going to reopen, maybe not as much seating. Churches will reopen. Maybe again, the gathering sizes will be less than we were used to in the past. Schools will reopen, but maybe they're still going to be more virtual than they had been in the past. I really have my doubts about big mass gatherings. The Indy 500, Lucas Oil Stadium. I'm not sure that we can put tens or hundreds of thousands of people in the same place at the same time until we have a vaccine. I think we'll still have these events. There just may not be very many people in the stands watching them. I am certain that we will have continued isolation for the elderly and infirm. I will tell you, again, we have an 86-year-old father-in-law that's living in our house. And so I've had the talk with 2 of my daughters and my grandsons that live with us. And I have said, you know what, just because theaters reopen and restaurants reopen doesn't mean that we're going to use them. Because if we go out there, we're putting ourselves at risk for getting the disease. And although it may not affect us favorably, it could have an extraordinarily negative impact on their grandfather. So we're going to continue to see that isolation. I'm hoping we're going to have antibody testing for everybody who wants it. Certainly, we're going to try to do that quickly here in Hancock County. And then COVID-19 testing for anyone who wants it as well, even without symptoms. That day is coming. On a personal level, I think that even though as a boss, I'm not sure about working at home. I think we're going to continue to do that because social distancing will still be the best way to protect ourselves. I think we're going to have more virtual everything. This is virtual. I think we're going to have more of this as we move into the future. I think the days of handshakes are gone until we have a vaccine, which is odd for me because it's kind of uncomfortable when you're used to shaking a hand and you just can't. Wearing these, I think, is going to be really important. Face coverings, again, protect those around us more than they protect us. And I am learning from my wife to be a germaphobe. I'm getting there, honey. I'm not quite there yet, but I'm on my way. So I think all this means that we're going to spend more time with family and close friends, and I think this is a good thing. So take advantage of this time, especially for people like me that are workaholics. So here's my last couple of things I want to share. As things open back up, remember, the virus is not gone. It is here, and it is infectious. So that part hasn't changed. But the predictable, steady growth in the number of people that has the disease mean we can be prepared for it and we can begin to reopen society. It's going to be different again, but we can get back to some semblance of where we were. And please know, it is the spirit of the law, not the letter, that is important. So if the governor comes out and says, hey, it's okay to have some parties, I don't think that means that we all just need to go out and party. We really need to think about it. Is it something that we really need to do? And if you have a choice, make the choice that's safe. Our individual choices are going to decide what happens in the future and whether we have spikes in this disease again. And none of us want that. So I really think it comes down to this. Follow the golden rule. We all know the golden rule. It's right there in the Bible. It's in every major religion. And it is do unto others as you would have them do unto you. So I wear the face covering because it protects the people around me. So we all can do things like that and be thinking about what's safe. We're going to get through this. We're going to get to the end. We're going to ride it out till we get the vaccine. We'll get back to normal. But for now, the new normal is coming. And if you want to hear more about this, please go onto our website. It is hancockregional.org/coronavirus. Or you can call our triage line, 317-325-2683. Or you can send us an email at nurse@hancockregional.org. Thank you very much for joining me. And you can also send me an email as well. I'm Steve Long at Hancock Health at Hancock Regional Hospital. Thanks much.